How to address lower back pain, and more in particular, how to address lower back spasms. Having spasms and lower back pain, it sucks, especially when you start to get sciatica. Everything's locked up. So the first thing you need to do and need to address is what is causing you to be locked up. Our hips are going to be in an anterior tilt. So what that means is they're angled down slightly. It's going to be more comfortable. It gives your hips a little more space. But see, the problem with this position is what caused our lower back pain was already having overactive tight hip flexors, having an elongated posterior chain. We get those positions because we sit so much. When we're sitting down, these muscles are shorter and these muscles are longer. So over time, the more we sit, the more we drive around, less time we spend trying to stretch our hip flexors and stay balanced, the tighter these are gonna get and the longer our posterior chain will get. So the first thing you need to do to help with your back spasms or your back pain is work on when you're standing still, and anytime you're standing up, work on your posture. You need to make sure you're squeezing your glutes, rotating your hips, and trying to keep everything in alignment. It feels a little funny at first. Make sure you squeeze your glute, rotate your hips under you, and try and keep everything in alignment. It might be a little sensitive, especially at first, but just try and squeeze your butt together, flex your butt cheeks, and keep your hips under you, especially if you're ever standing still. This will help keep everything aligned, keep your glutes engaged, help keep your hips in a longer position. Make sure that you are not trying to stretch out your back by touching your toes. Absolutely not. Part of the problem is your back is already in an elongated position, your hip flexors are already short, and the more you reach over to touch your toes, the shorter you're making your hip flexors, and the longer you're making your posterior chain. Please, please stop doing that. The pain is already coming because our back's either overactive or it's spasming. We need to create some more space for up here, so we need to stretch the front to keep everything more balanced up so you engage your glutes, one of your strongest muscles in your quads. And there's a couple different exercises you can do to work on that posture to keep our hips under us and our glutes engaged. And every time whenever on the ground, make sure that your legs are bent and you push your lower back flat into the ground. That's gonna help keep your back in that neutral position. It's gonna take the load completely off your spine, and it's gonna help your muscles relax. Because remember, if you're spazzing, it's engaging every muscle to protect your spine. It does not want you to get hurt. For the first exercise we're gonna do, a supine push-pull. So we're gonna lay down, bring our legs up, make sure your back's flat. We're gonna work on alternating, pushing and pulling our knees. We're gonna relax our head, and you're gonna grab one leg by the top, and the other leg you're gonna push. And you're gonna take a deep breath in the belly, and then exhale for 5 seconds and pull on one knee and push on the other. But try to keep everything neutral, so resisting it in each direction. Deep breath in the belly, exhale, we're pushing and pulling, exhaling, exhaling, exhaling. And then we're gonna switch positions, so switch our hands. Keeping our back flat, exhaling, tightening our belly, and pushing and pulling our knees, opposite direction. And keep them neutral. You can go through, do 5 to 6 rounds on each leg, alternating each time. The second thing we're gonna do is we're gonna get back in that supine position with our knees bent, and all you need is either a pillow or a soft ball that has a lot of give to it, and you're gonna lay down flat, you're gonna place that ball in between your knees. Relax everything down, keep our back flat, take that deep breath into the belly, and squeeze your knees. Squeeze them together as tight as you can. If you have a dysfunction going on in our hips, in our lumbo-pelvic hip complex, you may hear an audible little pop. It's your hips trying to go back in place. So you can go through, do 5 to 6 rounds on that exercise as well. So for the next exercise, we're gonna need a ledge, a chair, a bench, or a couch, something that's raised up, and you either need a lacrosse ball or a tennis ball. And if you're in a lot of pain, if your back's really spasming, start with the tennis ball. And that QL muscle is that muscle that runs down the sides of our back right here, and it goes at an angle going in. It's one of the muscles that really spazzes up. So we can put our feet up on the surface, get our back flat. Now you should have absolutely no load on our spine or on those muscles that are typically spazzing. First, try to relax a little bit. Take that lacrosse ball or tennis ball, and we're going to side of our spine. You can kind of switch around, try and find that muscle that's typically very overactive. We're still trying to keep our back flat, no arch. And then breathe in through our belly, and exhale, trying to sink deeper and deeper into that ball. Those are just a few exercises to help manage, get immediate relief from those spasms or that pain that you may encounter quite a bit. But remember, typically that pain is coming from our back already being too lengthened. Please stop trying to touch your toes and stretch your back. And take it easy on stretching your hamstrings. If you want to focus on stretching anything, please focus on stretching your hip flexors. Boom!